Hi again. We are going to be discussing the rhomboids in this video. So we're on page 82 and 83 in your book. So we're talking about muscles of the shoulders. So some of them are going to move the scapula. Some of them are going to move the glenohumeral joint. The rhomboids are going to move the scapula. So we are on the back of the body here. And here we are, rhomboid major and minor. So rhomboid major and minor are actually usually just referred to as the rhomboids. They are not distinguished by different actions or anything like that. And in fact, if you just sort of put them all together, rhomboid minor, which is this one here, sits just superior to rhomboid major. So they don't do anything different. They don't have different fiber directions or anything like that. And in fact, when I learned these, we learned them just as the rhomboids. So they're pretty much the same for all intents and purposes. Even in palpation, you can't feel a difference between the two. Let me get this a little bit bigger here. Okay. So again, we're talking about muscles that move the scapula in this case, and rhomboid major and rhomboid minor originate along the spinous processes of the spine. So remember, the spinous processes are these processes that stick out posteriorly from the spine. So this is obviously a side view. This is the view that you're looking at where you can see the spinous processes facing you, but they jut out posteriorly from the spine. So for rhomboid minor, we have spinous processes of C7 and T1. So cervical vertebrae 7, which is the big bump at the base of your neck. If you bend your head forward, the large bump that you can easily feel at the base of your neck is C7, and then the one just below it is T1. The origin of rhomboid major is the spinous processes of T2 to T5. Okay, so 2, 3, 4, and 5. So if you put them together, it would be, for rhomboids as a whole, spinous processes of C7 to T5, okay? Now remember, cervical vertebrae is C, thoracic vertebrae is T. Okay, so the insertion then is basically the entire medial border of the scapula. This is going to specify between the spine of the scapula and the inferior angle. So what we're really talking about is here, spine of the scapula, to here, inferior angle of the scapula. Okay, medial border of the scapula for, again, is kind of fine, but they like to be specific. You figured that out by now. Let me clear this for a second. The actions of rhomboids. We have adduction of the scapula, so that's bringing it toward the midline of the body, right? So like pushing out your chest, that would be the movement. What's another term for adduction when we are specifying the scapula? Got it yet? That's right, retraction. Remember, adduction and retraction, protraction and abduction. So see my shoulders, that's adduction, abduction, retraction, protraction. Okay. You can use them interchangeably. I personally prefer retraction and protraction because it mimics what happens at the mandible in protraction and retraction. You're moving it forward and back, and that's what you're doing with the shoulders too. So I like retraction, but just know that it is adduction as well. So we have adduction or retraction of the scapula, elevation of the scapula, and downward rotation of the scapula. Remember, that's when this part of the scapula, can I draw? I'm gonna draw. Goes, no, I don't want to text. Let's clear that. Fine, draw. Okay. Come on, let me draw, please. There we go. Okay. And this part goes like this, right? Downwardly rotates. The whole thing goes this way. Now, there's a really easy way to remember the actions of rhomboids. And I guess I will draw them in. I'm going to clear this for a second. I know, clear. There we go. So if I had the rhomboids on both sides, oh no, yikes, which I do, but this is really difficult to draw on the computer. All right, so both of these go like that. And then I'm going to draw, but I'm going to use brown because I have a point here. So instead. We're going to make it green because that's what I want to do. Okay, so when I draw it like that, when you see the rhomboids on both sides of the body going like this, the fiber directions go at an oblique angle, and you see them drawn in green, what does this remind you of? A tree, that's right. More specifically, a pine tree, and even more specifically, a Christmas tree. And here's why. Because if we change adduct to retract, okay, that's all I'm going to do. Retract, just fill in retract. If we change this to retract, then we have retraction, elevation, downward rotation, and it spells R-E-D, red. Red is part of the whole Christmas season. So these are the Christmas tree muscles, and their acronym for their actions is RED. Okay, that's an easy way to remember it. RED is Christmas, Christmas tree muscles, retraction, elevation, downward rotation. See, it has a nice cadence to it too. Retraction, elevation, downward rotation. Say that a couple times and you will definitely remember the actions for rhomboids. This particular drawing here at the bottom of page 82, it's a parallelogram, but it's talking about all of the different forces of pull on the scapula itself. Okay, and I think this is kind of helpful for students to see exactly how all of these different muscles pull on the scapula from these different angles. So obviously this is trapezius, here and here and here, and this one here is rhomboids. The little ones in pink are actually muscles that you haven't learned yet. They're called the erector spinae group. But in terms of sort of visualizing these fibers and fiber directions, I like this drawing. I think that's helpful. So rhomboid, the word, it's a parallelogram with oblique angles and only the opposite sides are equal. Did you remember that? What a rhombus is from geometry? Yeah, neither did I. It's okay, don't worry about it. All right. That's it for rhomboids. When we come back, we will have more deep shoulder muscles. Stay tuned.